Hi, I'm Courtney. Welcome to Something Positive for Positive People. That sound in the background is me calling our next guest. There she is.
I'm ready now.
Okay, good, because I already started recording and I told everybody that I was calling you. So,
Hi, everybody.
hey, hey, hey. So are we going to use your real name? We didn't talk about that.
Absolutely.
Okay, I have Angela Johnson here with the closed Facebook group Project
Project
Accept. Okay. And Angela, tell us about yourself. How old are you? Your ethnicity, sex, sexual preference, relationship status, and condition.
Never ask a lady her age.
Oh, but now that's a requirement of the podcast.
I'm actually really proud to say I'm 51. I'll be
Ooh,
51 in March.
fine wine.
Uh-huh. I live in Washington, the greenest state in the United States. I'm a mother. I have two kids. I'm bisexual, the best of both worlds. Um, uh, Relationship status single, forever, I hope.
Oh my God. How many cats do you have?
How many what?
How many
I
cats
have
do
no
you
cats.
have?
I date,
uh,
but I'm not looking for love or to fall in love. I'm actually getting ready to leave the country to do humanitarian work. So
no.
relationships aren't like top of my list.
Uh
So
huh. That's awesome. Where are you going to go?
I'm going to start in Nepal,
Mm-hmm.
and then I'm going to go to Africa, hopefully Ghana,
Oh, wow.
and then maybe Ecuador and South America. I'm a cultural anthropologist.
Oh,
So
okay. Well, that was one of my questions that I meant to ask you, but completely escaped my mind at the time.
Well, I'm a cultural anthropologist, so I'm passionate about other cultures, and so I've raised my kids, and now it's my turn to go live my dream.
Go enjoy yourself. I hear you. I hear you.
So,
So,
I guess one of the
oh,
important things about me is I'm a political activist.
mm-hmm.
So I'm very outspoken, and
Okay.
so that's very relevant to my story because it's part of my personality,
Okay.
and I know that not everybody can be outspoken, and not everybody wants to talk about herpes. Um, and I just don't have shame.
I
I don't
love
have
it.
shame around anything in my life.
I
So
love
why
it.
would I have shame around herpes?
Would you say that herpes was one of the things that made you begin to not have shame about anything else?
Um, I don't know, because my story is really different. Um,
Ooh, I love
it's
different.
it's really different, and I think I bring in a different perspective for people,
Okay.
and I hope that my story maybe helps other people, not realize that this really isn't that big of a deal.
Okay. Now, real quick, I don't think we touched on it, but which HSV do you have?
I've never been tested.
Mm-hmm. Really?
Um, yeah. So as far as I know, I only have HSV one oral.
Okay. And why do you say you've never been tested? Have you like just not gone or by
Because
choice or
herpes has been part of my life my entire life.
okay. So
And
how long have you had herpes as far as you know?
I think back to the first time I had a cold sore, I think I was around 10 years old.
Oh wow. So it's been a while.
Yeah,
Okay.
40 years.
So
So,
we didn't get to kind of do the background of the structure of the podcast or anything. I told you that I just wanted to get you on here so that we could just start talking because I know you have a lot to say and I know that this episode is gonna run long. So real quick, this is just your episode. If ever I'm saying anything or asking questions that you don't feel comfortable going into more detail about, just wave your hands and I'll be able to just stop it, pause it, and edit out whatever needs to be edited out.
well, in
But
this case, I'm sitting on my hands right now.
okay, good, good. So this is your episode. We'll start where we can start at your diagnosis or whatever you feel is relevant to the beginning of that time, and then I'll just ask you questions and listen from there.
Well, I guess as far as, like I said, there's really no diagnosis. So, um, I don't ever remember not having herpes.
Okay.
But like so many other people, I grew up with cold sores, which weren't the same thing as that other herpes, is what I was always grew up knowing. So, there are six kids in my family. Three of us get cold sores. Three of us do not. So I think back to a time when the two younger ones weren't born yet, and my sister was living with her dad. That left three of us in the household. That's probably about the time we acquired it. Keep in mind that my three other siblings had never been tested for herpes, so they very much could also have it and just be asymptomatic. So my older sister and my younger sister and myself all get cold sores. I grew up being teased about the cold sores, but I never took that too personally. It never broke me down. I never went through a process of acceptance or anything like that, because I always believed, oh yeah, I get cold sores, but they're not the same as the other herpes, so it's okay. And I never even realized how much they were transmitted. So my whole life, I simply, when I got in a relationship, at some point, I would say, oh, I get cold sores. Or if I ended up getting one, I'd say, oh crap, I have a cold sore. And never ever did a partner ever say anything in response, like, oh yeah, no big deal, or oh, I've got one before, or yeah, my mom gets some. But never was it ever put together as the other herpes. So, fast forward, I got married, I was with my husband. He had a terrible, terrible outbreak. And,
Was this outbreak orally?
no, his was genitally.
Okay.
So that's when I sat down and went, oh crap, I wonder if it could have came from me. And that's when I really started to sit down and study herpes.
Mm-hmm.
And I really started to look into it. And that's, I guess, my moment of when I accepted it, that, oh, wow, this is the same thing. And I can transfer my oral to his genital, and now he can give his genital to me. But it was never, for me, it was never like, I never cried, I never got depressed. It was just a matter of fact of, oh, wow, this is the same thing. But I've lived with this my whole life, and I've never had shame over it, you know? So I kind of had to accept. Thank goodness it didn't absolutely come back to me that it came from me, so I was able to release that guilt, because he had been cheating on me at the time. So I let him know, you know, it's not necessarily me. It could have been somebody else. So I just never had to go through those things. I never had guilt that I passed it on to him. I never had guilt that I had done something wrong. So fast forward, after the divorce, I took a year off, and I just started studying up on herpes, and I started to join the Facebook groups. And I started, I guess my only level of acceptance really was that, oh, I belong to this community. I'm part of this community, and accepting the fact that I now need to live my life responsibly, and accept the fact that my cold sores are the same as somebody else's genital, and I do belong to this community, and I do now have to disclose to everybody.
Mm-hmm.
So, but I'm even kind of a anomaly in the herpes community, because I'm oral, I'm not genital. But keep in mind, I've never been tested. And for the last 3 years, I only date other people with HSV.
Really?
So it's very likely that I could have it genitally too, but just be asymptomatic.
Uh-huh.
I don't know.
Now, my question to you is, why do you only date people who also have HSV? Is it just out of guilt? You don't want to feel guilty for giving it to someone else?
No, it's because I don't want to take antivirals every single day and have them, you know, because they're hard on your body.
Mm-hmm.
And I don't want to stress out and end up, because stress will give me a cold sore. And I just don't want to take all the precautions.
Right.
I personally, and I don't want to get too graphic, but I want to be able to give oral to my partner and not have to use a condom.
Yeah.
You know, so I don't want to take the precautions it would take to keep somebody who's not positive safe.
Yeah, it's kind of a pain in the ass. Like, not to say that condoms are a pain in the ass, but the whole, you know, because I have taken precautions in the past. Like, I don't know how effective they were, but as far as I know, none of my previous partners have contracted it. Thank goodness. But like I would shower beforehand. I would make sure that she were to shower afterwards. We would wear a condom, and it was just like this. The wearing of the condom part was annoying more than anything. And then as far as oral went, it was just like we both had to be very mindful. And I don't take the daily antivirals. I just take something whenever I feel there may be an outbreak coming. If I'm in a stressful situation, if I get sick with something else, let's say like the flu's going around. So if I get a cold or anything, then I just take the medication at that point in time, rather than dealing with the daily suppressants. Because working out and eating better have been very, very efficient for me. As far as managing my stress, which also triggers outbreaks, and then managing my body, which has limited my outbreaks. So like I can count on one hand the number of outbreaks that I've had, and I'd have to really sit down and think about how many I've had over the last 6 years.
Yeah, yeah. Stress is a major trigger, and it just, to me, the whole process of trying to keep somebody, who's negative, negative just seems like a lot of work and a lot of stress to me. Taking a shower before, in the shower thinking, oh God, and
Yep.
what's crazy is that I get pursued by more muggles than I do positive people.
And muggles are people who have not been tested
Yeah,
positively for
yeah,
herpes.
we've kind of, stole the word from Harry
Harry
Potter,
Potter.
those without the gift, and so, but and the muggles just don't seem to care because I'm so outspoken about it, and I'm so matter of fact, and I'm so confident when I speak about it. I speak about it publicly to everybody I know, every opportunity I get. For me, when I get a cold sore, I'm kind of excited because I know that somebody's going to say something, or I'm going to see somebody and I'm going to see them look at my cold sore, and boom, that's my chance to educate.
Right.
I'm looking for chances to talk to people about herpes.
Uh-huh. I
I
love
actually
that.
have a Project Accept sweatshirt that says "Got herpes," and I wear it as much as I possibly can, hoping somebody will say, "What?" and so I can talk to them and educate them. Because a lot of times it's going to be somebody who also has it, who is like, "Oh my God, I have it," and then I
Yeah.
get to educate them and bring them into the community and show them the normalcy of it. So,
Yeah. And it's kind of like that lighthouse effect. I had a conversation with someone about this. Like, people are looking for beacons of like hope or access to these communities, and it's very difficult to find until we have these different lighthouses that shine their light, and people see the light and they become drawn to it. And that's exactly what the sweatshirts do. I also thought about doing some sort of t-shirts thing or something, because there are people who want to support the podcast, and I just don't feel comfortable like directly asking for money for the podcast. People are like, oh, what can we do, and I'm always like, just leave us a review on whatever podcast player you're listening on. But I had this crazy idea to like make some sort of underwear or something and just put the
we
logo on there.
I'm not trying to
Oh
self-promote, but
no,
at
go ahead.
projectaccept.org, we actually sell sweatshirts, t-shirts, and we have underwear that say "It's just a rash."
Awesome. I like that. I like that a lot. So, I mean, I guess that let me know that I'm going down the right path here. But where can people find these underwear and sweatshirts and t-shirts?
Project Accept, and that's ACCEPT
Uh-huh.
.org.
Okay.
And,
Awesome.
and that's the Facebook group that I help admin with Nanette Swirly. She's the co-founder of Project Accept. So the website exists separate from the group,
Okay.
but the group is a closed group, so anybody can search for it and find us, and we just offer support and education and, people just learning about it. So
Yeah.
I guess, but something I want to speak about
Go ahead.
that I think people don't, the fact that I'm an anomaly in the community, in the sense that I've never had genital outbreaks, and so I don't, sometimes it's harder for me to relate and understand that pain and then, what they go through. But even within the community, I see the division. And what it is people with genital are like, God, I wish I had oral instead.
No.
And here I am with oral thinking, I wish I had genital instead.
Yeah, because like no one sees it.
Nobody sees it. You can hide it under your clothes, and the only people you have to disclose to are people that you're going to have sex with.
Yeah.
And you can take weeks and months to get to know somebody and have them know you before you have to disclose and have sex with them. For me to be a responsible herpes recipient, I have to tell people before I even go on that first date. Because what if they lean in for a good night kiss?
Yep.
That's how I transmit it. So for me, I have to wear my scarlet letter for the world to see. You know, I can't hide it. My grandson and my children, I always had to kiss them on the head or kiss them on the neck. I would never kiss them when I had a cold sore, but even when I didn't have a cold sore, knowing that I could shed, you know, your child comes in for a kiss and you put your hand up.
Yeah.
That breaks the mother's heart.
Yeah.
I mean, that's just, so there were things I went through that were hard, but I never felt ashamed. I was just cautious about it.
Yeah.
So I think that it's, even the problem is people believe the stigma, and the stigma's wrong.
Yeah.
It's absolutely wrong. And there's so much cognitive dissonance because even though people in the community know the stigma's false and it was just created by Big Pharma to sell their pharmaceuticals and that this is just a rash people have been getting for hundreds and hundreds of years, they still live as if they believe the stigma. And so they believe that cold sores aren't as bad.
But they're the same thing.
They have genital, and they live thinking, oh, I wish I had oral instead, it's not as bad. It's the same thing. The only difference is you're wearing it for the world to see.
Right.
So there's even a division in between the community of, oral isn't as bad as genital. With genital, people think you're disgusting and you're a slut and you're dirty. What do you think when, I've heard all those same things about my mouth.
Yeah.
I hear that, oh, you sucked a dirty dick. That's what I get. And I'm like, no, it was clean. He was showered.
Right.
But so it's just that division that even people within the community believe the stigma.
And there's not even just that division between oral and genital. There's also the division between type 1, type 2. When like I said, I've said this before, that I've been a type 2 snob. It's like, oh, you don't have type 2, like we can't go on this date. Like we can't talk. I don't want to deal with any more herpes than I already have. And come to find out, like there's not really there's no difference. Type 2 is more commonly genital. Type 1 is more commonly oral, but you can transfer one to the other. And so it's like, all right, no one has scientifically been able to explain to me yet if I'm like having oral sex with a woman, like there's no like gentle way of saying this. If she's performing oral on me, let's say that, like, are the chances of her getting HSV2 in her mouth just so much significantly lower, or what? Like there's no real explanation for the difference between type 1 and type 2. So there's that division as well. And like I said, I've been that person. I've been the one that has been like, I'm type 2, you're type 1. You just kind of stay over there. We can't do this. And like I've obviously grown out of that. Yeah, like I've grown out of that just with doing this podcast and becoming more educated from other people and talking about their own experience. It's really opened my mind to it and really made me realize, well, damn, what is the difference? So.
Yeah, and I kind of figure it this way. I've had HSV oral, whether it's 1 or 2, like I said, I don't know, and I don't care because it's not going to change anything for me to know whether it's 1 or 2. But I think having it for 40 years, I've probably built enough antibodies up in my system that even if I do contract it, acquire it genitally, I'm either going to be asymptomatic or the outbreaks are going to be so minimal I probably wouldn't even notice them.
Yeah.
So for me at this point, I could care less if I contract it genitally.
Yeah.
It doesn't change anything. It doesn't change the way I would have sex or approach relationships. So it's just disappointing to see people know the stigma is wrong, know it's false, know nothing about it is true. It has nothing to do with whether you're dirty or promiscuous or, but yet they still live in shame, knowing that it's not true.
Right.
And me, I have no shame around anything, and I'm not going to have shame around this. And when I hear somebody, talk negatively about somebody with herpes, I'm like, I have more information than they do.
Mm-hmm.
And because I have information they don't get to shame me because I know more than them. So my thought is I need to educate this person, because once they have the information I have, they're going to see this differently.
Right.
So I have a public page. I talk about it as, verbally as I can, whenever I can. I wear my sweatshirt so I can bring, have the topic come up. But the only way the stigma is going to end is if you and I and every person living with herpes educates other people.
Mm-hmm.
The media is not going to get rid of the stigma for us. The medical industry isn't going to get rid of the stigma for us. Big Pharma isn't going to get rid of the stigma for us. It is our responsibility as those who live with herpes to stand up for ourselves and end this stigma. And I know a lot of people think this is my own private business. I mean, people with genital think this is my private business and I shouldn't have to share this with anybody other than who I'm going to be intimate with.
Here's the thing about that too. Like, people with oral HSV are like, oh, it's just a cold sore. It's not herpes. Like, we have the miseducated people out there like that who think, oh, I can go and kiss, make out, and do whatever. This is just a cold sore. Not understanding, or even just being in denial about the fact that cold sores are herpes. Like, that's just what it is.
That was me for most of my life.
Mm-hmm.
For most of my life.
Yeah, and then it took, once you became educated, or the situation arose for you to educate yourself, you took that opportunity to do so. You educated yourself, and then you made responsible choices going forward about disclosing and how you went about continuing to move forward in relationships and educating yourself as well as educating others. So, awesome. Thank you.
I think those of us who live with cold sores need to be the leaders in ending the stigma, because we aren't afforded the ability to keep our status secret or private. We have to wear it, and people see it. So since we're not going to hide it, and people are looking at us anyway and judging us when we have a cold sore, take that opportunity to speak up. Take that opportunity to educate.
Mm-hmm.
Just because it's there anyway. Everybody sees it. Why let somebody look at you and give you a judgmental look of, she's got a cold sore? I'm like, oh no, let me tell you. Yeah, I have a cold sore, but this is herpes, right? It's the same thing as genital. It's not a big deal. 45 million people have it. I'm not going to let somebody look at me in a judgmental way and not take that chance to educate them.
Yeah.
So I commute on the bus to work. I'll talk about it on the bus. I'll talk about it at the bar. And what's really funny is I find my friends who, I don't know if they're positive or not, because they haven't shared that information with me, but I see their faces when I start talking about herpes in public. They're like,
just like,
oh my God,
really?
did you just say herpes? Oh my God, people are going to start looking at our table. Angela, stop talking about herpes. People are looking at us, and they don't even have it, but they have the shame of having the conversation.
Yes.
So I get people to the point where it just, all my friends and family, it's normal for me to post anything about herpes or talk about herpes. They just, and that's where I want it to be.
Yeah.
I want everybody to get to that place where it's no worse than having eczema, or, nobody freaks out if they had mono. You don't hide, I had mono, I can't tell anybody. People don't hide. Mothers go out and get, try to have their babies catch chicken pox. They actually have chicken pox parties so their kids will get it when they're at a young age.
Yep.
But it's herpes. It's just another strain of herpes, and I want 1 and 2 to get to that place where it's just a thing.
Right.
It's just a thing.
And an interesting thing I heard recently was someone disclosing, using the phrase, they tested positive for the antibodies of herpes. Like they have the antibodies in their system, and that was received very well. And I think that a big thing when in disclosing, a lot of people have issues with rejection simply because of how they feel about it. So if you're coming from a place of this is gross, this is disgusting, I'm embarrassed, this is a disease, I'm gonna it's the worst possible thing that can happen to me. When you come from that place and disclosing to someone, you're probably not in the position to be able to disclose to that person because you haven't come to terms with what it really is, nor have you been able to come to terms with yourself for you're a person who has herpes. You're not herpes. You're not everything that's associated with it according to the
Not your
stigma.
virus.
Exactly. Yeah, and it's a virus, and it's not a deathly, sickening disease or any of those other negatively associated words. But going back to my point about the antibodies, my girlfriend just recently, well, today actually, she went to the doctor. She got a physical, and I think she went and switched her birth control, and she told them about the herpes, and she had tested positive for type 1 at one point, but then more recently her results showed that she was positive for type 2, and she got an explanation today at the physician when what they said was, well, what happens is your antibodies, you tested positive for the antibodies for type 2, which is the one that I have, but this might not be a question for you because it seems to be really confusing as far as reading the test. And since you and I spoke about someone being able to really analyze these tests for us, this may be a question for them. But if we have the antibodies, like I remember my first test I took because I thought I had herpes when I was in college. So I went and I got a test for herpes, and it said that some number was under what it should have been for me to test positive for it. And today it was put in the perspective that the fact that I had a number there meant that the antibodies were in my body, which means I had already been exposed to it. Now, correct me if I'm wrong, but if you've been exposed to herpes, then you have the antibodies in your body, which means that herpes are in your body. So this technically means I've had herpes this whole time, even though it was too low to trigger an outbreak. But because I have the antibodies for herpes, doesn't that mean I'm positive for herpes?
And that's more a question for the medical
Yeah.
professionals in our group because I'm not a medical professional. But I believe those lower numbers relate to the people who are asymptomatic.
Okay.
So the numbers are never, and this is just my thought, their numbers never get high enough that they actually have outbreaks.
Got it. So I would like for you to connect me with any of those medical professionals. That is like the one thing I haven't had. I've not had a herpes medical professional on here. I've had HIV researchers on, but I've not had anyone who from the medical industry has been able to offer their...
Well, we have those individuals.
Okay.
I'm just not the medical person.
No, thank you. Thanks for saying that.
Keep in mind that the majority of people who have HSV don't know.
Yes.
You will never know.
And the last study that I've seen is that 80% of people
80%.
who have HSV don't know. It's not 80% of the population has HSV. It's 80% of the people who do have it don't know.
But it's very close to that number also of the people who do have it.
Oh, okay.
It is that high. Because it's spreading so rapidly, because so many people have it, they don't know they have it, and they're transmitting it to others.
Right.
So that's why it's rapid. And something we can talk about real quick is the CDC.
Mm-hmm. Center for Disease Control, right?
The what?
Center for Disease Control.
Center for Disease Control. And I have been grappling with this the entire time I've been in the herpes community educating and offering support. And I'm trying to see it from their perspective. But this is their recommendation, and the reason I feel like herpes is spreading so much is because people don't get tested for it. And when you go in to have an STD screening, generally HSV is not part of that screening. And the reason that it's not part of that screening is because the Center for Disease Control does not recommend it to be tested for. So a lot of times insurance won't cover your HSV test, and you're going to have to pay for that out of pocket because the insurance company says, oh, well, the Center for Disease doesn't recommend that you be tested for that, so therefore we don't include it and we don't cover it.
Mm-hmm.
So most people go in thinking, oh, I had an STD screening and I'm clean.
Yep.
I hate the word.
Yeah, and I saw your air quotes.
But then I tell them, but you probably didn't have an HSV test. You have to request that. And a lot of doctors will not test you for HSV if you've never had an outbreak and you haven't been exposed to it.
Mm-hmm.
And so you're thinking, why? Why doesn't the Center for Disease Control recommend it? Their stance is that the majority of people who do have it, that would find out that they had it through regular testing, are never going to have an outbreak. So it's never going to affect their lives.
Right.
But if they get a positive result, it can be devastating.
Right. And it's just like with the individuals who contemplated taking their own lives as a result of this, thinking that life is completely over.
They're like, is it better for them to know, or is it better for them not to know?
Yeah.
Well, you think about it, for them personally, for their personal health, it is better for them not to know and not have it affect their life. But at the same time, they're transmitting it to others.
Yeah.
And not knowing they're transmitting it to others. So it continues to spread. The other reason they take that stance of not testing is because with HSV, unfortunately, it's one of those tests. I don't know why. You'll have to ask Barry or Nanette, one of our medical professionals, why they haven't got to the point where tests, they have so many false positives and false negatives.
Oh.
If they test, they're going to be telling people you do have it when maybe they don't. Or you're going to tell people they don't have it when maybe they really do. So the inaccuracy of the test is part of the reason. So I understand that from the CDC's perspective. If we test people and these tests aren't accurate enough, we're giving false diagnosis to people, or we're not diagnosing people that should be diagnosed. So since there's not enough accuracy in that testing system, the CDC says, you know what, we're not going to go through that and recommend that you be tested and give you false positive or false negative test results. And we're just only going to, recommend that you be tested if you've been exposed to or had an outbreak. And I get that.
Mm-hmm.
But I also feel it's very, very irresponsible of a national health organization to know how quickly and how much this is spreading because their recommendation to not test.
Yeah.
I'm kind of torn. I see it from both sides.
Mm-hmm.
But, I guess maybe the place for us to work is to get more accurate testing.
Yeah. And I mean, and that's one thing to do.
Falses.
Yeah. That's one thing we can do. And just to kind of add to what you were saying, when it comes to the testing, I have a friend who's, she was raped and she had dated someone. So she knows that her positive, her HSV could have come from one of those two cases, but she's gone forward and asked her previous partner, who that she was on good terms with, obviously. She asked him to go get tested, and the doctor would not test him because he didn't have anything visible. He didn't have any visible sores. And the doctor actually just told him, hey, go, you're fine, just use condoms. So she can't get that closure, so this fucks her up. And then he could possibly have it, and he was just misinformed, told to go and make sure he uses condoms and he won't spread it. So he's going to go on, if he is in fact positive for HSV, thinking, okay, I can just use condoms, I'll use condoms, and have sex with whoever knows how many people, and then have that kind of same effect going on. And it's just like a ripple effect to how this is spread between people.
Yeah, and I used to think that was irresponsible of doctors. And I actually, every time I go to a doctor, no matter whether they're, my regular physician or my gynecologist or I even had a herpes conversation with my ear, nose, throat specialist a couple weeks ago. Because, you don't just get herpes orally and genitally. People get it on their hands, on their arms, on their thighs, on their butts,
Yeah.
My friend has it in her nose. So it's a conversation I need to have with him. But I guess you got to think of it from the perspective of the doctor. The doctor knows that if you have a lesion and you have an outbreak, and he swabs that, he is going to get an accurate test result from that. But he knows if you have nothing visible and he just does a blood test, he knows he might give you a false result. So I understand their position of not wanting to test you if there's nothing there, because they know that they might get a positive result back and it might be negative. So I try to understand it from both sides.
Mm-hmm.
But so honestly, this is the reality of it. Since the majority of people who have HSV acquired it before the age of 10 from a family member or a relative kissing them. And so they get it, either they end up like me having cold sores the rest of their life, or they don't actually have outbreaks, but they still carry it. And it's a ripple effect of just passing it and passing it and passing it. The only way I see to ever end the spread of HSV without a cure is if we stop kissing our kids.
Oh, wow.
And that's not going to happen.
No one's going to stop kissing their kids.
Well, you may save them, and that's sad, is so many parents with HSV don't want to kiss their kids because they don't want to pass it to them. But can you imagine the impact on a child if you don't kiss your child? Can you imagine the impact on a child if you put your hand up every time they run in to give you a kiss and you stop them?
Mm-hmm.
I think that is going to cause just more emotional distress than it would for a child to, my daughter, I don't know if she's going to, but she'll be fine. She got tested and she came back positive for HSV1 about a year ago.
Mm-hmm.
Not even a bump in the road for her. Not even a bump in the road, because she has been hearing me talk about education and herpes for years.
Mm-hmm.
So when she got that diagnosis, she was like, I know everything I need to know about this.
Thanks, Mom.
Because I educated her.
Yeah.
I educated her. She knew what it was. She knew everything about it. So she just came home and nonchalantly said, oh, I got my HSV test. I'm positive for one. And I was like, oh, wow. I'm like, well, I probably gave it to you kissing you. And she's like, that's okay. I'd rather you kiss me than not kiss me. It's not the end of my world.
Right.
So if people are educated when they get that diagnosis, it's not the end of the world.
Yeah. And a lot of times, like, we don't get that education upon diagnosis. We get a pamphlet, medication, and then we're sent on our way. There's no additional resources available to us or anything, and we're just on our own to go and start Googling stuff, which we always talk on here about how quickly that just turns into such a bad thing. Yep, there you go. This is a really good place for us to stop here. We're going to do a part 2 because I did tell everybody that the episodes would be between 25 and 35 minutes. And like I said, I knew you had a lot to say. So what I want to cover in the next part of this episode of Something Positive for Positive People is I want to talk more about the groups. I think that the support groups out there are amazing, and I would like to help other people find these support groups for themselves, and then we can go on and talk about whatever else just comes up, because I'm really excited to be talking with you right now, and I like how this is going completely unscripted. So
definitely, and because I'm a devil's advocate and I have a perspective unlike others, we'll talk about the groups, and I'll also talk about the downsides of the groups.
Awesome. I appreciate that. Well, you can say see you later or whatever you want to say in this episode to the people. They can't see you doing that. She's throwing up 2 peace signs. So this concludes.
You are not your virus. No shame.
No shame. Hashtag no shame. Can we do that?
I think so. I just wrote into Megan Kelly and told her that me too belong to the herpes community.
Oh my God. You are going to start something. Let me stop you down. All right, guys. This concludes part 1 of this episode of Something Positive for Positive People with Angela from projectaccept.org. Tune in for part 2. Oh, it sounds so professional. That's terrible. wait for part 2 to come out. I'll put them out at the same time, but you have to go from part 1 to part 2. If you're looking for me at all on social media, I'm on Instagram, Twitter, and Tumblr at H on my chest. Please continue to rate, review, subscribe to the podcast on your podcast player. And until next time, which will be not too long from now because you're immediately going to go to part 2, stay positive.